High blood pressure, as I've said before, is controlled in only about 27% of Americans, which is a starting point that is a little bit lower than optimal. Consequently, we do see plenty of hypertensive retinal disease. Now, that comes in different forms. There is sometimes basically the slow stress that happens uniformly and diffusely on blood vessels in the retina, and that can lead to a slow demise of the vasculature in the retina and therefore the health of the retina. And conversely, there can be events in the retina, such as strokes in the retina. They happen as a result of chronic high blood pressure, and they can involve bleeding in the retina, and fluid in the retina, swelling in the retina, and a decline in vision. There are excellent treatments now for the strokes in the retina and the swelling that results in a reversal of the vision loss if caught early. Plenty of good treatments, including laser and other medical treatments, as well as, of course, attention to the full body disorder that 9 out of 10 times is the cause of that stroke in the retina. So we check blood pressure on every patient, every visit. And the correlation with the impact on retinal disease in particular is really impressive. There are few large-scale bleeds in the eye, for instance, that we have not been able to relate somehow to at least a spike in blood pressure, if not a consistently high blood pressure. And this gives us great ability to prevent future loss of vision and future such episodes by getting to the heart of what is really causing this retinal disease, not just in the eye, but in the full body.
He was the first doctor to ever address my blood pressure, so now I'm on blood pressure medicine. He monitors that. He stays on me about that every time that I go to see him. You know, it's through all the years I've never been diagnosed with that, or anybody has ever brought issue to that. But he says that is very, it can have a strong effect on the eyes.
Sometimes I'll go in and my blood pressure may be elevated a little bit. He say, well, Mr. Grew, did you take your blood pressure medicine today? Yes, sir, I took my blood pressure medicine, Dr. Ebrahim, but he's really concerned, I think, about his patients. And like I said, I really, really do trust him with my eyes.
We see a lot of patients that complain of floaters in the eye. It's one of the things that really drives patients quite crazy over time. But the floaters themselves, I like to explain to people, are not the disorder. They are, however, a very, very important symptom that people can recognize at home that can be indicative of some very serious disease in the eye, including retinal tears and detachments. The retina is like wallpaper in the eye. The gel in the eye is the vitreous, and it's connected to that wallpaper at birth. As we get older, that gel likes to collapse in on itself and pull away from the retina. It's a natural process. There's nothing wrong with it. During that process, you tend to see shadows of particles floating through that gel, and that's floaters. In some people, during the process of separation of the gel from the retina, it will maintain too strong an attachment and pull a tear in the retina, which can lead to a retinal detachment, which is very serious and potentially blinding.
It's been 8 months and my vision has retained its old vision, what I would have seen before, so it's really good.
You should understand that not everybody with floaters has a retinal detachment, so we don't want to alarm people in that regard, but you do have to have somebody lay eyes on the retina to make sure that it's not damaged.
Without my eye surgery and Dr. Ebrahim in the Retinal Eye Institute, I was unable to perform my duties as a driver.
Dr. Ebrahim received his MD from Georgetown University School of Medicine, then returned to New Orleans for ophthalmology training at Tulane University. Afterwards, he trained in retinal surgery under the most published retinal surgeon in the history of the field. Dr. Ebrahim founded the Retina Institute in 2005 to provide leading-edge retinal eye care to patients in the greater New Orleans area. For more information or to schedule an appointment in Metairie or the West Bank, call 504-455-0500, North Shore 985-871-9920.
In the process of discussing macular degeneration and wet macular degeneration in particular, we discussed medical treatments. That includes Lucentis and Avastin, which have really changed the field of treatment for macular degeneration and now many other disorders, including diabetic retinopathy. Well, there are many other medicines coming down the pipeline. Some medicines like VEGF trap and others will concentrate on doing the same job that these other medicines have done, like Lucentis, but in depot formulations. What that means is that there will be slow-release treatments that will require fewer treatments less often, but still give hopefully the same benefit and control of the disorders that we have with other medicines that we have available now. That field is really changing rapidly in a medical sense. There are thousands of researchers working at all times in the field of retinal care and retinal disease. Now, it's a very slow process in filtering out all these new possible treatments and finding out which ones work, and then eventually some of those actually get delivered clinically in the office, but only if they're found to be not only effective but safe for patients. It's something we take very seriously. My personal interest is in stem cell research and the factors that can actually stimulate regeneration of the retina. I find that to have much more of a future in my mind than artificial implants. And in that regard, I think that for many of the disorders that we treat now, like diabetes, macular degeneration, the hypertensive eye disease, retinal detachments, macular holes, uveitis, etc., there will actually be a host of factors that we can apply either directly in the eye or as pills for full body disorders that can help regenerate even eye disease, and for implantation of stem cells directly in the retina or under the retina or in the eye somehow to help regenerate retina and really reverse retinal disease on a level that we're not capable of yet. Smoking has been found in numerous studies to really have a direct negative impact directly on diabetic macular edema, on macular degeneration, and uveitis and other eye disorders. These studies are constantly coming out, and I think that the common link there is that smoking increases inflammation throughout every tissue in the body, and the eye is not excluded from that. Inflammation, not infection, but inflammation, is at the heart of many disorders that we look at in the body, increasingly so with more and more research. And smoking, increasing that inflammation, is really moving us in the opposite direction from the direction we're moving in of most preventative measures such as antioxidants, etc., which decrease inflammation. Many treatments that we give directly in the eye, such as Lucentis and Avastin and other medications, are designed specifically to reduce inflammation. And so again, smoking is sort of a counterbalance in an area of inflammation, taking us in the direction that is the exact opposite that we need to in order to not just keep these diseases from getting further, but in many instances preventing their diagnosis and their onset altogether.
Dr. Ebrahim is very cautious about, he just over and over again tells me what I need to do. And some of the things are hard for me to do. I'm a smoker, and he is very, very graciously, encouraging me to give that up, and I am trying. Dr. Ebrahim gave me some vitamins to take, which I didn't know there was a vitamin for your eyes.
There's a very dedicated staff at the Retina Institute that really are a large part of the excellent care that we're able to deliver at all of our locations. These are people that I rely on very much, and the patient comes to rely on. We have been with me for many years, most of these people. They are very skilled in taking the patient through the process from beginning to end in a comfortable, respectful environment with great attention to their disease process and the state of mind that comes with being worried about your disease process. That's something we take seriously. We really try to walk people through that as kindly as possible.
The staff has always been wonderful, yes. I could call them the staff at the Retina Institute. And I guess I've been there so many times they know exactly who I am. They're, okay, Ms. DeGroot, when you want to come in, which office, because I live on the West Bank, so a lot of times they'll ask me which office I want to come to, the West Bank office or the Metairie office.
I love his staff. His staff is very professional, very caring. They're always calm. They're always reassuring. They know you by name. They will work with you if you need to change your appointment. They are always there to help you, and they ask about your family and your children. And Dr. Ebrahim also, he's very professional, very calming, reassuring, and I feel he's very knowledgeable and I trust him.
Everyone in my family has brought me to see Dr. Ebrahim, and he takes the time to explain, show the pictures that they take of my retinas. He explains everything to them so that they're able to understand, because when somebody can't see through your eyes, it's hard for them to understand, you know, what's going on with you, and he takes that time to explain all the pictures and, you know, encourage me to, you know, lifestyle changes and the vitamins and such.
At the Retina Institute, we're privileged to receive referrals from other doctors and other eye doctors, mostly in the area, for our specialized retinal care. We really try to stay in close connection with those doctors in treating the patient, letting them know our findings, keeping them apprised of the care of the patient in the context of their overall care of the patient's eye care. And for primary care doctors, their care of the patient's overall medical status. At the Retina Institute, there are many treatment options available, all of which really require a good diagnosis to start with. And that starts the cascade of figuring out what is particular to that patient and what their particular needs are in terms of therapy, whether it be a laser, medical treatment, or surgery in the operating room. That is the process that is the job of any retinal surgeon and that we take pride in at the Retina Institute. The mission of the Retina Institute is really quite simple. We're there to give you the best, the most advanced retinal care available in the context, as we've stated, of your full body disorders as well as your retinal disorders, such that by linking it all together, there is no base unchecked. And when you leave the care of the Retina Institute, it's our goal to make sure that there really is nothing more that could have been addressed either in your retinal disease specifically as treatment in the eye or in treatment of your full body disease to give you the absolute best outcome. Our feeling is that if at the end of the day, no matter what happens with your outcome, you and us can look back together and know that we did everything we could, then that's the most satisfying way to handle things.
My vision is so important to me. I have children, and I want to be there for them all of the, throughout their lives, and to be able to be their mother.
My vision is getting better with all of this procedures, and I'm hopeful.
To get to the type of eye care that we have at the Retinal Eye Institute and Dr. Ebrahim is worth the drive. It's a godsend that he was putting on my life.
The best thing about having the Retina Institute in this community is knowing that I have a professional such as Dr. Ebrahim that I trust with my vision health.
I would not go to any other doctor. I would recommend him to just about anybody and everybody that I see, because I see quite a lot of people, and I would tell them, I really do trust him.
Very thankful to have found Dr. Ebrahim, because eyes are very important. I do not want to go blind.
And for a quick visit to a specialist like Dr. Ebrahim, and it may change your life.
Dr. Ebrahim received his MD from Georgetown University School of Medicine, then returned to New Orleans for ophthalmology training at Tulane University. Afterwards, he trained in retinal surgery under the most published retinal surgeon in the history of the field. Dr. Ebrahim founded the Retina Institute in 2005 to provide leading-edge retinal eye care to patients in the greater New Orleans area. For more information or to schedule an appointment in Metairie or the West Bank, call 504-455-0500, North Shore 985-871-9920. If you've been diagnosed with diabetes or macular degeneration, you should protect your sight with regularly scheduled eye exams. The Retina Institute provides comprehensive eye evaluations that could help save your precious sight. With convenient locations in Metairie, the North Shore, and the West Bank, it's easy to schedule an appointment. Call 504-455-0500 in Metairie in the West Bank or 985-871-9920 on the North Shore. The Retina Institute, when you need leading-edge retinal eye care.